Disclaimer: this content is provided for informational purposes only and does not replace professional medical advice. Always consult your doctor for any health concerns. Hello everyone, and welcome back to Health Pills. Today, we're tackling a topic that affects millions of people every year: heart attacks. These events can strike without warning, but the good news is that our bodies often send warning signs days or even weeks in advance. Unfortunately, many of us ignore these signs or mistake them for minor issues like stress or fatigue. In today's video, I'll show you 8 key symptoms that may indicate a potential heart problem. Recognizing them early can make the difference between life and death. So, get ready to take notes and share this information with your loved ones. Let's dive right in. 1. Persistent fatigue. Fatigue is one of the most common symptoms people experience, but when it becomes persistent and unusually deep, it can be an early warning sign of a heart problem. This isn't the kind of tiredness that comes from a long day or physical exertion. Instead, it's a lasting and overwhelming exhaustion that doesn't go away with rest or sleep. People with this type of fatigue often find themselves struggling with daily tasks they used to do effortlessly, such as climbing stairs, carrying groceries, or even simple chores like cleaning the house. When the heart isn't pumping blood efficiently, oxygen delivery to the body's muscles and organs is reduced, forcing the body to work harder to compensate. This lack of oxygen can leave you feeling weak, lethargic, and even mentally drained. Some people may also notice muscle weakness and a decline in their stamina over time. It's important to recognize that fatigue can affect both the physical and mental state. You might feel unusually irritable, depressed, or have trouble concentrating, which can make everyday activities even more challenging. While fatigue can be attributed to other factors like stress, aging, or poor sleep, it should never be ignored, especially if it is prolonged or severe. If you notice that no amount of rest seems to improve your energy levels and the tiredness interferes with your daily routine, it's time to take action. Persistent fatigue could be your body's way of signaling that your heart is struggling to meet its demands. Seeking medical advice promptly can help identify any underlying issues before they escalate. 2. Shortness of breath. Shortness of breath, also known as dyspnea, can be a major warning sign of an underlying heart condition. It's not the kind of breathlessness you feel after intense physical activity. Instead, it often occurs during simple activities like walking a short distance, climbing a few steps, or even while sitting still. This kind of unexplained breathlessness can be alarming, especially when it develops suddenly or progressively worsens over time. When your heart struggles to pump blood efficiently, less oxygen-rich blood reaches your tissues and organs. To compensate, your body increases your breathing rate, trying to bring in more oxygen. This is why people experiencing heart problems often feel as though they can't catch their breath, even with minimal effort. In severe cases, shortness of breath can occur at rest or while lying down. This condition, called orthopnea, is often associated with heart failure and may cause people to prop themselves up with pillows at night to breathe more easily. Shortness of breath can also be accompanied by a sense of chest tightness, discomfort, or pressure. For many people, this symptom is easy to dismiss, especially if they have conditions like asthma, allergies, or anxiety. However, when shortness of breath becomes frequent, persistent, or occurs without an obvious cause, it's crucial to seek medical evaluation. This symptom often worsens with physical activity but should not be ignored even if it seems mild. By paying attention to changes in your breathing patterns and activity tolerance, you can catch potential heart problems before they become severe. Don't wait for shortness of breath to become debilitating. Early detection and treatment can significantly improve your outcomes. 3. Chest discomfort. Chest discomfort is one of the most well-known warning signs of heart problems, yet it doesn't always present as the sharp, severe pain many people expect. Instead, it may feel like pressure, tightness, fullness, or squeezing in the chest area. Some describe it as if a heavy weight is pressing down on their chest, while others report a dull, persistent ache. This discomfort can occur intermittently or persist for extended periods, and it shouldn't be dismissed lightly. The sensation may not always be localized to the center of the chest. In some cases, chest discomfort can radiate to the arms, particularly the left arm, shoulders, back, neck, or even the jaw. Women, in particular, are more likely to experience subtle or atypical chest discomfort, such as a feeling of pressure that doesn't seem severe but doesn't go away. What makes this symptom challenging is that it can sometimes be mistaken for less serious issues like acid reflux, indigestion, or muscle strain. For example, if the discomfort occurs after eating, some people might assume it's simply heartburn. However, if this sensation is persistent, recurring, or occurs with activities like walking or climbing stairs, it could be a sign that your heart isn't getting enough blood and oxygen. It's especially important to pay attention if chest discomfort is accompanied by other symptoms like shortness of breath, sweating, nausea, or dizziness. These could be indications of reduced blood flow to the heart, a condition known as angina, or even an impending heart attack. If you experience chest discomfort that lasts for several minutes, worsens with exertion, or appears suddenly, don't ignore it, seek immediate medical attention. Early intervention can save your life. 4. Sudden sweating. Sudden, unexplained sweating, particularly when it's cold and clammy, can be a sign that something serious is happening with your heart. This type of sweating, known as diaphoresis, is not related to physical exertion or high temperatures. Instead, it occurs as a result of your body responding to stress caused by reduced blood flow to the heart. When your heart struggles to pump blood effectively, the nervous system triggers a fight or flight response, releasing stress hormones like adrenaline. This hormonal surge causes your sweat glands to activate, resulting in cold, clammy sweat that often feels out of place. People experiencing this symptom often describe it as a sudden wave of perspiration, sometimes accompanied by dizziness, nausea, or chest discomfort. What makes this sign particularly dangerous is that it can mimic less serious issues, such as a panic attack or a bout of anxiety. However, if cold sweating happens without a clear trigger and is accompanied by other symptoms like chest pressure, shortness of breath, or lightheadedness, it should never be ignored. This symptom can occur anytime, during activities, at rest, or even while you sleep. Waking up drenched in sweat for no apparent reason may also be a warning sign that your heart is under stress. If you experience cold, sudden sweating alongside other concerning symptoms, it's essential to take action quickly. Seeking prompt medical care can help determine whether your heart is at risk and prevent a potential emergency. 5. Dizziness or lightheadedness. Feeling dizzy or lightheaded can occur for many reasons, but when it happens frequently or without an obvious cause, it could signal an underlying heart problem. Dizziness often occurs when the heart isn't able to pump enough blood to the brain, resulting in a temporary drop in oxygen supply. This symptom can feel like the room is spinning, a sensation of being off balance, or even a brief loss of consciousness. In severe cases, dizziness may progress to fainting, which can indicate that your cardiovascular system is struggling to maintain proper circulation. Some people may notice that dizziness worsens when they stand up quickly or after even mild physical activity. Changes in blood pressure are often to blame. For example, a sudden drop in blood pressure, known as hypotension, can cause dizziness because the brain isn't receiving enough blood. This condition can occur when the heart is weakened or when blood vessels are obstructed, as in coronary artery disease. Dizziness can also appear in combination with other heart-related symptoms, such as shortness of breath, chest discomfort, or sudden sweating. If you experience frequent lightheadedness, particularly if it's accompanied by any of these other signs, it's important to seek medical evaluation right away. Don't dismiss dizziness as a minor issue. While it can sometimes be caused by dehydration or fatigue, persistent episodes can point to serious heart-related concerns. Paying attention to this symptom and addressing it early can help protect your heart health. 6. Pain in other areas of the body. Pain that spreads to other areas of the body is a subtle but serious warning sign of heart trouble. While chest discomfort is the most common symptom, pain can radiate to the arms, shoulders, back, neck, or jaw. This happens because the heart, nerves, and surrounding muscles share similar nerve pathways, which can cause pain to appear in areas other than the chest. For many people, pain in the left arm is one of the most well-known signs of a heart attack. It can start as a dull ache, heaviness, or tingling and gradually intensify over time. However, heart-related pain doesn't stop there. Some individuals may feel pain or discomfort in their upper back, between the shoulder blades, or along the jawline. Women, in particular, are more likely to experience these atypical pain patterns, which are often mistaken for unrelated issues like muscle strain or dental problems. The key to recognizing this symptom lies in its persistence and context. If you feel pain that seems unusual, unexplained, or worsens with physical exertion, it may be time to pay attention. For example, if you experience back or neck pain alongside shortness of breath, sweating, or fatigue, this combination of symptoms could signal reduced blood flow to the heart. One of the biggest challenges with this symptom is its subtlety. Many people dismiss the pain as a pulled muscle or arthritis, delaying critical medical intervention. If you notice pain spreading to areas like the left arm, back, or jaw, especially if it occurs with other heart-related symptoms, seek medical care immediately. Addressing this warning sign early can prevent a potential heart attack and save your life. 7. Nausea and indigestion. Nausea, indigestion, or even vomiting can be surprising symptoms of a heart problem, but they're more common than you might think. When the heart isn't functioning properly, it can affect the digestive system due to shared nerve pathways. As a result, some individuals may experience symptoms like an upset stomach, bloating, or a feeling of fullness that doesn't go away. Women, in particular, are more likely to report nausea and digestive discomfort as early signs of a heart attack. These symptoms are often dismissed as minor gastrointestinal issues, such as acid reflux, food poisoning, or an upset stomach caused by stress. However, when nausea occurs alongside other heart-related symptoms like sweating, chest discomfort, or shortness of breath, it's important to consider the possibility of a cardiovascular problem. The connection between the heart and digestive symptoms lies in reduced blood flow. When the heart struggles to pump efficiently, the body prioritizes blood flow to critical organs like the brain and lungs, reducing circulation to the digestive system. This can result in sensations of discomfort, fullness, or nausea. If you experience persistent nausea or indigestion that doesn't resolve with over-the-counter remedies or dietary changes, it's essential to look for additional symptoms. Feeling clammy, weak, or lightheaded alongside digestive distress could indicate that your heart is in trouble. Don't dismiss these signs as trivial, especially if they occur suddenly or worsen over time. Seeking medical attention promptly can help identify and address underlying heart issues before they become life-threatening. 8. Irregular heartbeat. An irregular heartbeat, often described as a fluttering, racing, or skipping sensation, can be a sign that your heart is under stress. While it's normal for your heart rate to increase during exercise or periods of excitement, persistent irregularities could indicate a deeper problem, such as arrhythmia or an impending heart attack. When the heart doesn't pump blood efficiently, it can cause the heart's electrical system to malfunction, leading to abnormal rhythms. This can feel like palpitations, a sensation where your heart skips a beat, beats too fast, or pounds heavily in your chest. Some individuals may also experience a slow or erratic pulse. An irregular heartbeat can be accompanied by dizziness, shortness of breath, chest discomfort, or fatigue. This combination of symptoms suggests that your cardiovascular system is struggling to meet the body's demands. In some cases, palpitations are harmless and caused by factors like caffeine, dehydration, or stress. However, persistent or unexplained irregularities should never be ignored, as they can signal serious conditions like atrial fibrillation, AFib, or coronary artery disease. If you notice that your heartbeat feels abnormal, especially if it occurs alongside other symptoms like dizziness or sweating, seek medical attention right away. Monitoring your pulse and identifying patterns in your heartbeat can help your doctor diagnose the issue and provide appropriate treatment. Remember, your heart's rhythm is a critical indicator of its overall health. Addressing irregular heartbeats early can prevent complications like heart failure or stroke, ensuring your heart remains strong and functional. Conclusion: recognizing these 8 warning signs can help you take action before a heart problem becomes life-threatening. Pay attention to your body's signals, and don't dismiss symptoms like fatigue, shortness of breath, chest discomfort, or sudden sweating as minor issues. If you experience any of these signs, especially in combination or without an obvious cause, seek medical help immediately. Acting quickly can make the difference between life and death. Thank you for watching Health Pills. If you found this video helpful, don't forget to like, subscribe, and share it with your loved ones. Turn on the notification bell so you don't miss future health tips. Stay healthy, stay informed, and take care of your heart. We'll see you in the next video.